As an athlete, I don't want. I was surprised the way you talked about how so many of the college football athletes were using cannabis, and I did play some Division One, not football, but at Penn State, and we had a couple All-Americans on the team, and many of the users, including at least one All-American, I don't want to call them all out,
Yeah, no names.
were regular cannabis users. So, do you see it as having performance enhancing aspects for athletes, or what are your thoughts on cannabis as an athlete?
Yeah, and that's a great question. A great question. So I'll put two tiers to it. So one tier, now that it's more healthier ways to utilize it, I do see it being an asset to the athletes if they know how to use it and systemize it, et cetera, right? For their benefit. And then on the other end, from what we know right now, I don't see it having any type of backlash like opioids. So maybe that's the route to go. I know I realized last week I was reading and I see in Israel, this is random, Jake, but it's going to make sense. In Israel, when the police pull up or the hospital, when they drive to a incident, they have to give the oral, and it kind of relaxes them all. So if the athletes take that same approach, maybe you don't have to smoke it, right? Just a little oral dab or whatever. I think it'll be beneficial and it'll help them for sure.
Uh, just allow me to follow up on that. I'm not sure about the particular Israeli study, but one of the Israeli studies where they used cannabis alongside or in ambulances had to deal with post-traumatic issues, whether that be a car accident, sexual assault, acts of war. When the ambulances would come upon the scene, the paramedics would do their assessment and they would administer cannabinoids very early on in the trauma-based process. And one of the results, and we know there's lots of good human studies now on cannabis helping with PTSD.
Sure.
So we know that it helps. And one of the things that the cannabis and the cannabinoids help with in trauma-based PTSD is that part of the problem with PTSD is we get these traumatic memories and we can't get them out of our brain, and they affect us in our sleep, and it becomes very difficult for us to forget the traumatic memory. And the cannabinoids appear to be helping modify the memory aspects, almost like forgetting the trauma. There was a young buddy of mine. He was a football player. I played lacrosse. I'm not going to say his name, but I believe it was in the Penn State Oklahoma game, which was for the national championship, but maybe it wasn't that game. He was a freshman, and I think he was playing safety or cornerback, but it was a big football game. And all of a sudden, there goes my buddy as a freshman running out onto the field. And they threw the ball to the receiver that he was covering. That receiver caught a touchdown. And this kid never got over it. And the next year, he wasn't on the team. I did have the privilege of playing intramural flag football with him. He was a quarterback, and we went really far and did really well. But athletes can have traumatic elements in their careers where you get something stuck in your head and like, I can't do it, or big rivalries between different athletes and I can't beat this guy.
Sure.
So perhaps cannabis can have some effect that way. But
I love that you said that, Jake. I think about at the practice level, you compete so much and it creates some type of anxiety for the next day. And I think that cannabis can come in at a perfect time to kind of relax that anxiety. I know everybody preps for Sunday when the NFL, Sunday nights. You have so much anxiety Friday and Saturday. It's tough to eat a little bit. I'm going to be honest. And that's where that cannabis can come in too there. I see it so many beneficial ways as long as you utilize it and talk around it and just educate people around it.
Perceptions of events before they happen are a critical part of athletics. If you can notice a particular player doing something earlier than you otherwise would have. It helps with reaction time.
Okay.
And people ask me as a surfer, and I'm not a good surfer, but I still surf. I was just in the water yesterday, heading out again this weekend. Do I see cannabis as a performance enhancer for surfing? And I think that on the bigger, as I approach my limit, which is not great by any stretch, I think it's absolutely not. But on smaller, more comfortable days, at least I don't have any data for this, but I do get a sense that I can read the ocean better.
Oh, nice.
So,
Okay.
so perhaps reading an offense or a defense better. We might get some really negative comments because we're encouraging players to do this, but I'm just talking about this psychological aspect of cannabinoids versus the physical. I was going to mention post-workout recovery and topicals. Mm-hmm. You have a lot of experience with topicals. Was it shoulder or knee for you? Remind me of how did you use topicals as a recovery piece?
It started off by shoulders, but being safety. But the best spot for me was my knees, and it felt amazing. And sometimes I just do it before I go for a walk. I just drop them on my knees.
We've been talking a lot about how cannabis might work. Mm-hmm. Why don't we talk about how cannabis doesn't work?
Yeah. That's a very touchy topic because it's all like individualized, And I say that to say, I heard you mention one time on one of your talks that the dose is the poison. And I'm like,
I copied that from a guy named Hippocrates, a Greek guy, the father of modern medicine.
But it's very true. It's very true. But our dose is so much different, Jake. Your dose may be different than mine when we both go surfing, right? So it's just so tough to talk about. And that's where the cannabis not so good aspect come in, when you don't understand yourself and understand your education. And I like to say, the more you know about yourself, the more you can place yourself. And that's huge in the cannabis industry, I think, personally.
And we mentioned the trauma piece earlier. Because cannabis is so flippin' good for dealing with trauma. We live in a trauma culture where we're accumulating traumas, a lot of us, especially depending on your situation. Everybody's got a different situation. And cannabis can be so good for trauma that I wonder if we can escape into it. And at a certain point, it goes from being therapeutic, helping us deal with the situation, to stopping us from dealing with other situations.
Exactly. And that's where Don't Let It Smoke You comes in perfectly, So I'm glad you mentioned that. I actually had a few questions for you. You mentioned, you're okay with sharing your use, if it's okay talking about a little bit around that.
With certain areas, I would say, but I am an open book as far as that goes. Absolutely.
For sure. Well, let's start off with the topicals, right?
Oh, yeah.
More about topicals. I would like to know more about how you use topicals. Is it more of an everyday thing? Is it more of a like right before I go to sleep, like a routine or ritual type of thing, or when you feel aches?
Okay, honest truth here. I wish it was every day, but I guess I'm allowed to swear. It's my own podcast. I can't afford that shit every day. So yes, I think that because I'm an old dude who still uses his body most days, and that changes as any young person who has the luxury of growing older finds that the body doesn't respond as well. So I would, because it is still very pricey, I typically use it just about after every surf session, or if I'm doing any kind of intense physical activity. And in a perfect world, I would use it before I did any activity, because I think that not only can enhance performance because the muscles don't get as sore. I think it also may have some injury preventative aspects to it.
Gotcha.
I first learned about, way before I went to medical school, I was living in Santa Fe, New Mexico, and a buddy of mine from Las Vegas, New Mexico, not Nevada, he is what the local people call a curandero. Curandero comes from the root word of cure, local healer. And his family had a 400-year history of passing down from grandmother to son. He learned a lot of his healing techniques from his lineage. He was the first guy, and this would have been in, when was I in New Mexico? 96, 97-ish, long time ago, was telling me how a lot of the local people would be using a tincture of multiple herbs, one of which included cannabis for sore muscles, but it was in an alcohol tincture. And so it wasn't a lotion or anything, but that they would apply it to the area. And that stuck with me for a long, long time, because I went through a process, and it wasn't until about 15 or so years ago that I really started to key into cannabis as a medicine. And then I remembered that story, got myself interested in Washington State early before, adult recreational legalization. We had a medical legalization. And the model was a co-op model, so that you could band together with other people, and one person might be a good grower, another person might be good at making brownies, which is what we did at the time, etc. And so I started talking at little co-ops around and giving them my opinion. Nice. And that's when I discovered Topicals. And I think somebody gave me I was a patient, so I could participate legally, but somebody gave me some Topicals early on, which really, really, really helped, because that's what I use cannabis medically for as just when I get banged up and I'm sore. And it really makes a quick difference as far as that goes.
I'm glad you mentioned that. I actually have a question. And I'm going to illustrate this question for you, okay? So, and hopefully you can speak to this, because I think especially young adults, this makes sense. So if I put lotion on my hands, it stays on the surface of my hands. If I put CBD on my hands, it extracts, it pulls down into the muscles and the bones. What is that that's pulling down? What is that?
There's a technical term called osmosis. And diffusion. You can Google those, but basically things will move from an area of high concentration to low concentration. And you're absolutely right. The skin is a barrier. So some things will cross through the skin and some things don't.
Sure.
So when we've been in the water a long time, the outside of our skin absorbs water, but the inside doesn't. So we get those little wrinkles in our skin. What crosses the skin barrier tends to be things that can be dissolved in lipids, also known as fats, or alcohol. But water tends to not cross the skin. So lotions will have a water component to them. They'll have a fat or a lipid component to them. And CBD crosses the skin actually very easily. THC, not so much. So CBD is very easy to get across the skin. And we know from animal studies that not only does it get across the skin, but it gets all the way into underlying muscle tissue, at least in animal studies. And we have the beginning of our pain reception starts out in the body. Those signals then go to the brain, where it processes the pain response. So with a topical cannabis product, I use the analogy of a Bluetooth speaker that you run on your phone or your iPad. Where can you adjust that volume? Well, if my phone's on the other side of the room and the speaker's over here, I could just touch the buttons on the speaker. Or if the speaker's on the other side of the room and my phone's over here, I can adjust the volume on my phone.
Makes sense.
So topicals are like adjusting the phone or adjusting the volume at the speaker. When we put them on locally, part of what's happening are anti-inflammatory aspects, but also Part of what's happening is that it is changing the volume signal as it travels up to the brain. So it's actually working on multiple levels, so that if somebody is getting relief medically from cannabis for pain, from, I don't like gummies because kids can eat them, but from something that they eat orally, tincture or whatever, they might likely also be able to get some additional relief from a topical. What's also cool about topicals is even if you use a topical that has THC in it, that will not get you a head high. And there's a biologic reason for that. If you're interested, I can go in it. But as I said, THC crosses about 1/10 as easily as CBD. But what we do know from studies, at least in animals, is that it appears that a combination in a topical of THC plus CBD works better than either alone. And also topicals are dose dependent. So if you're purchasing a topical, you want to look at the total milligram amount that is in it. Because it's not about the size of the lotion, it's about the amount of cannabinoids that are in it. So you might actually get a value from buying a smaller bottle at a greater price than a bigger bottle at a lower price. It depends on how concentrated it is. Just like, I don't like to use an alcohol example, but it's the only one. Just like some beer is 3.2% alcohol, some beer is 7% alcohol, they have a different concentration.
Got you. And that's very well said. Falling under topical moving forward, will it just be oils and ointments, or do you think anything else that will be created?
Well, that's a great question. I think the market is going to have to determine that. One of my old girlfriends used to say, "I'm not going to use cannabis as a topical until it's like become a foo-foo product that's just as smooth and nice as her expensive creams." We're not quite there yet on the formulation aspect. My opinion, Tarris, on the medical side, which would correlate over to the sports and performance side, I like a Brazilian rainforest oil called Copaíba oil. I'll put that in as Copaíba oil because it has a lot of a molecule called beta caryophyllene in it that also enhances pain relief and has cannabinoid-like actions, but it is kind of a weird smell. And I also like castor oil, which most people think of as something that if you get constipated, you take castor oil, that clears everything out. But we're talking about it topically. And castor oil is a really not a great texture, and it can stain clothing. So on a pure performance medical side, I can think of lots of products that really don't appeal to folks because of the way they go on the skin, but that might be effective. Some people are not going to like those. Yep. Other products to reach a different audience or a different consumer group, you're going to need to make them much more fragrantly pleasant. I typically don't mention brand names. I'm thinking of one rose scented one that my mom uses that just has a beautiful smell to it and decent texture. So different groups are going to have different preferences. But to answer your question on a pure performance side for athletes, a lot of athletes aren't going to care about that. If it works better, then they're going to be happy with that. And likewise for pain patients as well.
Okay. That's great. That's great. I think I was speaking to my mom last week, and her sister's now starting to use topicals. What advice will you give to someone who just starting out, but don't want to go to any type of physician or doctor or anything like that? What advice would you give to the individual for them to figure out their dose and just how to kind of get into the game?
For a topical or just in general?
For a topical. For a
topical, I'll use my mom as an example. You got to use it, and you got to use a lot of it. And my mom, I know my mom, she will use it till it's down to about a half a bottle, and then she stops using it because it works so good she doesn't want to run out. So So making sure that there's access, and also the prices just have to come down. And I don't know how or when that's going to happen. When it's expensive, and so for people to use it liberally and freely, the prices have to come down.
Sure.
And I think that there's a chance. You've got your MBA, so you probably know more about these types of things than I do. But you need to use a lot of concentrated product. The cannabis hemp plant it requires a lot of expertise and scientific and artistic knowledge to grow consistent A+ top shelf cannabis. Without a doubt, that is a pro game. But for C+ cannabis that maybe doesn't really look that great, you can grow a lot of that very affordably. And I see those types of things being able to go into topical products, maybe help bring the prices down. But there's a price point problem that we have. And I know because, it can be very expensive. So also, surface areas, things that are closer to the surface. So for example, with knees, you mentioned very helpful for your knees. That medial meniscus on the inside of the knee, very close to the skin, that medial collateral ligament, very close to the skin. Knees can be great. Also, if you're not worried about using too much of the product, we do think that there are some interchanges between nerve conduction in the spinal cord that if you actually, even though the pain might be on the inside of your knee, if you put the topical all around the entire joint, that might have some better pain relieving properties than just on the particular area. Okay. I think even though it's very hard to treat, things that cause hand pain like osteo or rheumatoid arthritis can be very good. Bursitis on the elbow, also topicals if you're going camping, summertime, and you don't like mosquito bites, bug bites, insect stings, can be very helpful for that. For folks who get too much sun exposure at the beach, you get some sunburn, it can help with the burning pain from sunburn. So these are some areas that folks might not think of using topicals where they actually might be a benefit for some people.
I didn't even know that, and that's tons of value there. Thank you for sharing that.
Yeah.
What is the bad thing about topical? Give me one bad thing. Anything
they don't last very long. There's 2 hours, maybe 4, 6 tops, and they're gone. So if you can't get to sleep because your knee pain is bugging you, you put a topical on at 10 p.m., it's going to be back up at midnight, making you have to roll over, et cetera. So they don't last very long.
For sure.
That's one of the big downsides. Their expense obviously is another, and the fact that you have to use a lot to have an effect. Certain product formulations can cause barriers. Alcohol applied to the skin can enhance penetration. So I think a lot of formulas don't penetrate as well as others. People mention nano products. I don't know if those work. I've seen a few studies that I didn't like, and I've also seen a couple studies that made me think, So if you're a manufacturer listening, doing your own in-home, if you're a big company, you can design trials to help us understand this better. The main side of is that's one of the main sides, but I think topicals is actually one of the best ways to introduce people to cannabis, because you don't have to get a head high from
what if the kids say, hey, I don't want it to take that long, Jake? The young generation, they say, I don't want it to take that long. I want something that's going to happen now. What will you tell them then? Other than vaping, other than smoking, what will you tell them then?
Just wait a couple years.
You're going to find
who am I to tell? I know where my mind was when I was, 14, 16, 18. So it's hard to it's hard to hear your elders sometimes.
Absolutely.
But don't give up on it. And we were chatting about this in our last conversation. I haven't met many athletes before the age of 27 or after the age of 27 or 28 that haven't had a major thing happen to them, whether it be injury or some other kind of health issue that they've had to overcome.
Mm-hmm.
So I think that young athletes, especially for someone who wants a long career, including Olympic or professional level, where you can perform very well, certain if you maintain your body, and well into the early to mid 30s now, and depending on the position, quarterback, for example, apparently forever. But but you are likely as an athlete, and make comments in the comment section, usually by the time 27, 28 or so, most folks who want to continue will have some type of something that they have to overcome. Mm-hmm. So if you're young and studly and a superstar and you've never been injured, great. Remember this after, if you are lucky to have a long career, maybe think about topicals then. As I mentioned, I learned about topicals in New Mexico a long time before I actually put them to use in my body. And they don't take that long. They're also mildly effective. They're not majorly effective. So if your knee pain is at a 5 out of 10 on the pain scale, 10 being the worst, maybe the topical can take it down to a 3. But with a 5 out of 10, you're not going to be able to run and jump as well as at a 3 out of a 10. So even that 2-point difference can be a factor. And also, lots of other oral medications people take. People take a lot of ibuprofen. Athletes will do a lot of ibuprofen post-recovery. They can be wonderful anti-inflammatories and very effective, but they're hard on the stomach and they can be hard on the liver and kidneys. Yep. So to be able to reduce that is talking about life extension. I'm going to rewind it to, I asked my sensei in Japan, I was studying martial arts, and Yoshimura sensei, I asked him something along the lines of, what can I do? I asked him, what can I felt like I was at a plateau, like I was working really hard and not getting better. And I asked him, what can I do to improve myself? And he basically said, play the long game. And if you want to play the long game, study shiatsu, which is the Japanese acupressure. So I went and I did. I studied acupressure, shiatsu, for 2 years in Japan. That sensei, Mishima sensei, hey, Mishima sensei, if you're listening, he's still walking the planet. He said to me something that I didn't believe, but I was polite and I pretend I believed it. And he said that sports are bad for the body. And I was like, that can't be true. I didn't say it. That can't be true. How in the world are sports bad for the body? You look at any athlete, they have the best bodies in the world. How can sports be bad for the body? Well, you tell me, Tarris, you have a couple collisions. How is that on the body?
Yeah, it's tough, especially if you don't take care of it. You know, we get told to kind of just keep going, keep fighting, you know, tough it out. And if you don't really take control and really like pause and just really, you know, take care of it, it hurt a little bit more than later on down the line for sure.
And what do you have to say for the young ones coming up?
Yeah, I would say, you know, educate yourself is huge. I would say also do what you like to do. Just don't let it control you. And then last thing I would say is, you know, keep listening to Jake like I did when I first started, and keep learning a little bit more about the ECS and a little bit about where cannabis is going. And then you can figure out where you want to place yourself at moving forward, for sure.
I always say, do your own thinking and learn what you know. Is there anything I haven't discussed that you would want to share with folks that I maybe might not have asked you, Tarris?
probably what I'm trying to do with Don't Let It Smoke You. I started off as a book. I do corner classes. Literally, I go to downtown Seattle. If I'm in Georgia, I go to Georgia, and all for free. And I try to just give out the education that I do have right now that I'm still learning more and more each day. So I'm doing corner classes. I'm looking to turn Don't Let It Smoke You into a movie one day soon. Once cannabis is everywhere, like coffee shops, it'll be great if we turn it into a movie where kids can like not let it control them. I think that'd be helpful. And I'm just really, I went through it. I'm not an expert. I'm not a doctor, but I went through it, and I want to help someone else not go through it. So that's where I'm at. And that's my goal. And that's what I want to do.